Hi, it's good to see you again since our last consultation, and you've been scheduled to undergo your distal radius fracture, and I would like to make this video to give you a little more information about your surgery. Since our last visit, my schedule was able to get approval for your surgery. And I want to give you some information to help you throughout this process. I'm sure you're not comfortable right now, I'm sure you're in pain, but I want to give you some information to help you. First of all, your surgery will be done with a regional anesthesia with sedation. When you arrive to the facility, our anesthesiologist team will do a regional block to your extremity, so your entire extremity can go to sleep. Then, during the surgery, they're going to keep you with a light sedation that you won't remember anything, but you're going to be breathing by yourself. It's very unlikely that a general anesthesia will be required. When I do the surgery, I use a plate fixation that the majority of the time will make an incision on the front of your wrist and will put a plate to reduce your fracture. As you see in your X-rays preoperatively, the fracture is displaced, meaning it's out of socket. Our goal is to align them so they can have the normal angles of a wrist so you can prevent the development of arthritis and chronic pain to your wrist. Sometimes patients have a very weak bone and is associated with osteoporosis, which can complicate your healing. Right after surgery, after we fixated your fracture, you're going to have a splint on the front and on the back of your wrist. And this splint is going to stay there until we see you back. Depending how the fracture went, I either will have you to see my physical therapist department in 1 week or 2 weeks to start early protective range of motion. Some other patients may need to be in a cast and don't qualify for a early range of motion. I will see you back when you're 2 weeks after surgery. At that time, X-rays will be obtained and we'll look how your fracture is healing. And if the fracture is holding up well, the plate is good, the screws is fine, it's probably likely that I'm going to let you start doing early protective range of motion. Then, when you're 6 weeks out from surgery, that's the time we're going to repeat your X-rays. Hopefully, you're not going to be having more pain to the fracture site. And at that time, I'm going to remove the removable brace, or if you have a cast, the cast will be removed. X-rays will be obtained once again, and we're going to let you start doing a little bit more with your hand. You can start doing 5 to 10 pounds. When you're 12 weeks out or 3 months from surgery, once again, X-rays will be obtained. We'll also have you to answer a little questionnaire on the iPad, and you'll see how you're progressing with your hand. At that time, if everything healed well, we'll let you start doing more and more with your hand. And some patients, I see you back at 6 months. But I want you to remember that this process of healing, it might take you up to 1 year. Some patients may have pain right on this corner of the wrist. It's called the ulnar styloid. And this may take up to 6 months for the pain to go away. So I would like to say thank you because you chose me as your surgeon. I know you're not very comfortable right now, but my goal is to help you so soon you can recover, start using your hand, and be back doing your normal activities. And I'm looking forward to seeing you at the day of your surgery. Thank you.